Hi and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. Today I'm going to be answering a question that gets asked a lot in therapy, which is why do some of my alters just not speak to me? Some alters just aren't communicative, some really are. So within Dissociative Identity Disorder people have alters or parts. These are different aspects of the personality or the identity, often related to traumas experienced early in childhood. And these alters that can carry many aspects of trauma, many memories, many emotions, and people, as part of their journey through therapy, want to get in touch and want to communicate. And it's often something that as therapists we encourage, try and build up that sense of internal communication between the self and the parts. So why would it be that some alters just don't want to communicate? Well, from talking to people in therapy and sort of looking at this issue and trying to understand it, I've come up with two reasons in the main. The first of these reasons is that many alters may be stuck in trauma mode. So they are heavily linked with the negative emotions, maybe the fear, maybe the anger of that trauma. And they do not want to emerge, or they don't want to come out, or if they do come out, they don't want to communicate with the person in any meaningful way. So the person may be aware that they're there, but can't actually get in touch and can't do some of the therapeutic work on stabilization because that alter remains out of reach. It could be that the alter is frightened of being hurt again, that to communicate and to open up, to be part of the system means that they'll be at risk, so they may not want to. It might be that they're behind a dissociative barrier, that for reasons that are yet unknown, that part simply isn't able to understand or know that others exist within the system that they're actually in. I suppose with this type of alter that doesn't want to communicate is to be patient, is to not try and push, to ultimately not be frustrated or angry that that part isn't actually able to speak with you. Don't worry about it. I suspect in many cases it'll be down to timing. So whether or not that part is willing and able to come out, it just may not be that now is the time for that. So try and be patient and wait and see what happens. It could well be that when that part feels safe enough to communicate, they will be there and they will be able to do so. The other reason then why a part may not communicate is that they do not believe that you as the person feels that you really want to. Have to try and remember that all alters within a DID system are part of the same brain. They share the same ultimate memory and experience, even if it's fragmented, even if it's sort of separated out in those dissociative ways. So if you say that you want to communicate with that alter, but really behind that statement is a sense that you don't want to, or you're frightened to, that alter is possibly going to be able to pick that emotion up, pick that sense of not being wanted up. Additionally, it could be that you've tried to communicate with that alter and been frustrated or been angry about that, and that emotion is being sent forward, projected towards that alter, and the alter simply will be able to know that they're not wanted, and that is going to reduce the likelihood that they're going to want to communicate with you. See it like a phobic response. If there's something that you want to approach and you know that you should, but you feel terrified of doing it and therefore you don't really want to, that is going to get picked up by the alter. Remember that this is often part of a traumatic attachment system. So not being wanted, not having a sense of belonging, not feeling part of things is, from many people, an intrinsic part of that trauma. So if an alter is separated, is dissociated out, and a person is wanting to get in touch with them but they don't really want to, that alter may feel rejected, they may feel that they don't belong, and therefore they're not going to talk back in return. Any sense of unease or anxiety about talking to those alters also will be picked up, and that anxiety and that worry can also trigger then a secondary dissociative response in the present day, and the alter remains away because they think by communicating it is actually a scary, anxiety-provoking experience. They're not going to want to do it. The answer then is the same for the first type, is to be patient, to try and understand that the alter may be frightened, may be scared, or may be angry with you, and therefore be patient and give it time. To constantly put out that message that they are wanted, that you do want to get in touch with them. And I think it's really important to be able to send that message out to the alters in either a verbal or a non-verbal way to say that you are worried, you are frightened, you are anxious about communicating with them, but you want to do it anyway. that you know it might be difficult for both of you to be in touch, to communicate, that might raise loads of issues for trauma, loads of issues for stress, and be prepared to hold on to that. So if the alter is willing to get in touch and is willing to communicate at some point in the future, you will do your best to look after them. If they're frightened, if they're worried, if they're angry, you will hold those emotions, you will be able to look after them. Again, these are things that are best done in a therapeutic relationship where you can be guided and supported by your therapist to be able to link up with that alter, and if a wave of emotion or if a sense of memory or trauma comes back with that alter, you are already in a contained setting to be able to manage and deal with that. There we have it. There are going to be other reasons why alters don't communicate, and each individual will have those unique factors about them. What we've been looking at today are some general factors. So the first being that alters may be stuck, they may be locked away, and it might not be the right time for that alter to be able to communicate, so be patient. And the second might be that they don't really feel that you want to communicate, that they don't feel that they belong, that they don't feel that they'll be listened to or looked after. Again, be patient and try and work with that alter, even if they don't communicate to you, to not get frustrated or angry with them, but to continue developing that chain of communication, and ultimately one day I suspect you will be able to communicate with them, and if done within a therapeutic relationship, whatever comes with that alter will be able to be held and managed and contained within a safe setting. I hope this video has been useful. Please like and subscribe and leave comments at the end of the video. Thank you very much for listening, and take care.